Although much of the country has apparently forgotten that we're still in the middle of a pandemic and that thousands of people are coming down with new cases every day and lots of people are still dying, we do have to bear in mind that even once people have recovered from coronavirus, that does not mean that they are free of consequences, as many people are finding out financially. I want to go through just a couple of the excessive bills that people have received following their successful recovery from coronavirus. The first is Janet Mendez, who started receiving bills soon after returning in April to her mother's home from Mount Sinai Morningside Hospital, where she nearly died of COVID-19. First, there was a bill for $31,165. The next one was impossible to ignore, an invoice for $401,885.57, although it noted that thankfully the hospital would be paying for a significant chunk of that as a financial assistance benefit, but her tab was still, for that bill, $75,000, all told over $100,000. Now, hopefully the insurance company is going to take care of some of this, because apparently there have been so many phone calls to the hospital about it that they have decided they're going to cover a portion of it. It will still leave a significant bill, and that is where everything lines up right. That the hospital does what they're supposed to do, that the insurance helps out. You could still be financially broken, even after successfully living through the terrifying experience of coronavirus. So we're going to have others, but Francesca, I want to give you a chance to weigh in on this. This financial part, I don't think enough people are really talking about.
No, especially when there were promises to assist and help out with any kind of COVID treatment or hospital stays. And there was money allotted in one or the two, or maybe I think it was the very first phase of the stimulus budget. And I think if you followed that money, you know that a lot of the hospitals that have been receiving that money are private hospitals, and they've been in turn laying off a bunch of people in order to cover these costs, when actually they could just cover the cost. They would just have to take less of an income. They would have to make less profit. These are profit-making hospitals. The entire model, when you look at these bills, right, you see that the gouging that is going on, the price gouging, the sort of like the layers of feeding and profiteering off of whether it's, well, we had to transport you to this room and we had to do this x-ray and we had to do that test and we had to do this. Everyone is eating off of this privatized healthcare system, and it's falling on the backs of the patients.
Yeah.
And if it's not falling on the backs of the patients, it's falling on the backs of the taxpayers who are giving this stimulus money to these hospitals, rather than saying to the hospitals, nah, you're just gonna actually have to make a sacrifice. You make the sacrifice.
Exactly. Yeah. Yeah. And it really, in the end, it will come down to who pays. But we're going to have another individual I'm going to turn to in a second. And the human cost is the true cost. But I do want people to acknowledge, one of the reasons I want to talk about this is that, let's say, cases are going up in a number of states. I know that, you might think Texas must be doing okay because Ted Cruz spent the last 24 hours arguing with Ron Perlman about wrestling Jim Jordan. That's literally a thing that's happening right now. But no, Texas is seeing skyrocketing hospitalizations from coronavirus. Now, the biggest issue with that is that almost certainly more people are going to begin to die in some states. Arizona, Florida, Texas, all states are getting hit very hard. But also, let's say we've learned a lot about how to treat people. Let's say that the people who are getting sick might not be coming from nursing homes, so maybe they're a little bit less likely to die. They're still going to be in intensive care, on ventilators. Costs are going to be driven up, and someone is going to pay for it. Not to mention the threat of death, and also, by the way, of being maimed for the rest of your life, because apparently many of the people who have successfully recovered from serious cases of coronavirus have organ damage following it. They've lived, but it's not like they just shook off a cold. No, their lungs, they might need lung transplants afterward. So letting it continue to spread in this way isn't just irresponsible in terms of the death toll that it might result in, but also the significant human cost in quality of life, and also the significant medical expenses that someone is going to pay for at the end of the day.
Yeah. I mean, we know the ways that medical debt then impacts the economy as a whole, right? We're always taught to look at unemployment, and we're always taught to look at the stock market. Oh, the stock market is going to tell us whether the economy is good. No. check out how many people are suffering with medical debt. How many people have become homeless because they couldn't pay their medical debt and then couldn't pay their mortgages or their rents. And we have an incredible wave of evictions, of a housing crisis coming at us, and then compounded with the medical debt associated with COVID. And again, there is some relief for that. But like John's saying, it is going to be lasting. Like you don't just get over this.
Yeah.
I guess I just think what we're doing to the prison industrial complex and the policing, whatever, like our policing in this country, let's do to the healthcare industry what we're doing to policing right now. Yeah. All right. The whole thing must go. The private healthcare industry has got to go. All right. You can no longer make money off of us because absolutely, whether or not you're shooting people down in the street, you are effectively killing poor people and predominantly people of color because of how expensive and how inaccessible the healthcare industry is, the private healthcare industry is. Yeah. So I say we should, while we're at it, let's get rid of it.
Yeah. Oh, Bernie.
Oh, Bernie.
And I just want to quickly mention another case. So there was one individual, Michael Flor. He spent 62 days in intensive care because of COVID-19, induced coma. His bill was $1.1 million. The total cost is almost certainly going to be higher because apparently the bill that he got, the $1.1 million, doesn't include things like dialysis, the nursing facility, and stuff like that. So it's going to be even more. His bill was 181 pages, basically the same as the dissents that we talked about earlier. 3,000 different itemized charges. Now, the good little end to this story is that he believes that the vast majority of it will likely be paid for because thankfully he is covered by Medicare, but a lot of people are not going to be. And a lot of people are going to find that when they get their bill with 3,000 itemized things, their hospital is going to pick and choose which they pay for. They're going to fight and drag it out for as long as possible. So when you get out of the hospital from COVID-19, you not only have, lifelong medical issues you're going to have to deal with, but you get to deal with the bureaucracy that's been set up in the provision of healthcare. And best case scenario, you only have to pay tens of thousands of dollars. But God help the people who don't receive so much scrutiny that the hospitals decide to pay it off, that the insurance decides, you know what, we've done 6 months of this. I really don't feel like paying for 70% or 80% anymore. And that is almost certainly coming. We got multiple crises on the horizon, and that is one that I don't hear nearly enough conversation about.
No, and watch the money, because after all this, now, by the end of this year, we're absolutely going to see healthcare CEOs, the heads of private healthcare companies making bank, the billions of dollars. I mean, there was something like $8 or $9 billion that like the top handful of healthcare CEOs made in 2017, something like this, like in the last, like billions and billions of dollars, right? We're going to see that COVID is making people rich at our expense.
Yeah.
And it's one of these things that we're like, well, what's going to last? How are our lives going to change after the pandemic is over? No more private healthcare. I want to leave that behind, please.
Hopefully.
Please, if I just ask nicely enough.
Yeah, exactly. What American politics is needed is people to be more polite. People out of power need to be more polite. Absolutely. That's actually what Fox has been saying. Anyway. Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.